So you are worried about your child being overweight or obese, or you're wanting to prevent it, or you want to learn more about it, so you've come to the right place. I'm Dr. Bonnie Drager. I'm a dual board certified pediatrician and a pediatric ICU doctor with a long experience in taking care of kids both sick and well. So let's talk about obesity today. Obesity has become one of the most common chronic childhood illnesses. So how do we define obesity? So how would we know that your child has obesity? So when you go to your pediatrician's office for your annual checkup, they usually will check your height, weight, and body mass index or BMI. Now this BMI is what is used to define obesity. So when they plot the body mass index, which takes into account both the height and the weight, against a growth chart, and if your child's BMI is greater than 85th percentile for her age and sex, then she is classified as overweight. And if your child's BMI is greater than 95th percentile for her age and sex, then she would be classified as obese. So these are the two numbers that we use to define obesity causes and risk factors of obesity. So what puts your child at risk to develop obesity if she's not already overweight or obese? So it can be broken down into the following things. One is a genetic factor, two is the socio-economic and environmental factors, and three are the lifestyle or personal factors. So what are some of the genetic factors? So actually, genetics as a cause of obesity or a genetic disease as a cause of obesity in childhood is actually only about 5% to 10%. About 90% of cases are actually idiopathic or unknown or multifactorial. So some of the diseases which are caused by genetic problems, things like Cushing syndrome, Down syndrome can make you prone to obesity. You can have Beckwith-Wiedemann, hypothyroidism. So these are some of the diseases that actually have a genetic cause which makes you prone to obesity. So those are monogenetic, where there is a single gene defect. Whereas there are other factors which are more complex, such as polygenetic or epigenetic, where you don't necessarily have the particular gene to make you obese. However, you may have the genes which predispose you towards obesity if the environment and the lifestyle factors are set up for that. So in other words, the good news is that even if you have the epigenetic or the polygenetic factors which may make you, prone to obesity, however, they will not come into expression or they will not make you obese unless the lifestyle comes into play. So if you modify your lifestyle and your environment, just having a genetic predisposition doesn't mean you are destined to have obesity. So I think that's the good news. So that's the genetic factors. And then the other things which, the environmental things, like where do you live? So people who live in the under-resourced or underserved communities may have lack of access to proper grocery stores, may have lack of access to fresh produce, fruits and vegetables. If there is a lot of fast food restaurants nearby, if there is a lack of a safe space for children to go outside and do physical activity. So those are some of the environmental factors. So it depends on where you live, which socioeconomic background your child is coming from. And then some of the lifestyle or personal factors, which I think are the ones that you can control the most, is your diet, which includes the portion sizes. Are we eating appropriate portion sizes? And number two is, what type of food are we eating? Is it more fast food or ultra processed, some of that junk food? What kind of fruits, vegetables are you eating? Is it a high fiber diet? And then the sugary beverages, which is actually probably the number one culprit of childhood obesity, is consumption of the sugary beverages. So things like your Gatorade. Some of the other lifestyle factors are screen time. So how long is your child spending in front of the screen? The sedentary lifestyle. So the more screen time you have, that leads to being more sedentary and lack of physical exercise. And other things associated with that are if there is any kind of childhood stress or any childhood adverse experiences, trauma. So all of these things combined. So as we said, obesity is a disease. It's a chronic disease with many factors at play, and a large majority of that would probably be the lifestyle and the environmental, which I just talked about, and then with other things coming into play such as your socioeconomic status as well as the let's look at the effects of childhood obesity. So childhood obesity not only causes problems down the road on physical health of the child, but as well as the emotional and mental health of your child. So it is something we should definitely look into and treat as soon as possible. So some of the actual diseases that could result as a result of your childhood obesity is things like dyslipidemia. So you have increased triglyceride levels, lower HDL cholesterol, which can impact the heart health. Other things such as type 2 diabetes or pre-diabetes, insulin resistance. You can have poor exercise tolerance, easy fatigability. Obstructive sleep apnea is a common one, which can actually become like a vicious cycle because that leads to, snoring, poor sleep, and then that leads to more fatigue during the day, and then more sedentary lifestyle, and so on, where the obesity perpetuates. You can also have things affecting the hormones, so increased hyperandrogenism in females, which can lead to a polycystic ovary, or overweight can also lead to problems with the liver, so it can cause liver disease or non-alcoholic fatty liver disease. So your liver enzymes are elevated. It can also cause gallstones, gallbladder disease. It can even affect the musculoskeletal or your bones and can cause problems like the slipped capital femoral epiphysis or SCFE, which causes limping in the child because your femur bone gets dislocated because of the excessive weight, and that can cause limping in a child. So those are some of the common medical complications which we can see in children who have obesity and overweight. So it definitely takes a toll on the health of the child, and then not to mention the emotional distress it can cause a child. So these children wrongly, but they tend to be bullied in school, or it can also cause an impact down the road on their emotional health, can lead to depression, anxiety, and other things. So overall, it can definitely have a big impact on the overall health of the child, and hence, what are we going to do about this? So just like any other chronic disease, it's a long-term treatment. It needs a group approach to the treatment, and your pediatrician would be a good resource to start with, because you definitely would need help regarding the diet, nutrition, etc. But just in a nutshell, the American Academy of Pediatrics came out with a recent guidelines on treatment of obesity in a comprehensive article, and the overall guideline is that the lifestyle modifications has the biggest impact on the overall outcome. Even if it is a genetic, epigenetic or polygenetic, changing the lifestyle would probably be the biggest beneficial impact on this, and this needs to be done in conjunction with the pediatrician, with the dietitian, and the parental involvement, because without the parental involvement, obviously we cannot make changes. So the biggest thing would be, if my recommendation or take-home message for trying to remember, because it can be overwhelming, is something you can do, some simple steps you can take to start making these lifestyle changes would be 5, 2, 1, 0. So remember to take 5 fresh fruits and vegetables a day. So in other words, encourage more fruits, vegetables, more fiber. So change the diet, portion control, and then 2 is minimize screen time to 2 hours or less. And why are we worried about the screen time? Because that promotes more sedentary behavior and lack of exercise. So 2 or less of screen time. And 5, 2, 1 is 1 hour a day of physical activity, either moderate or vigorous. So anything will count. Your child can go for a walk, biking, swimming, going out and playing. Any movement is good. So 5, 2, 1, and then 0 is the 0 sugar sweetened beverages. So try to minimize that. When you go grocery shopping, try not to buy juice, soda, Kool-Aid, Gatorade, any of those. So Pedialyte, Gatorade, those occasionally they are fine. So when your child is sick or is doing some sports, drinking Gatorade is fine, but shouldn't be drinking those sports drinks or any other beverages which are sugary on a daily basis. Just remember that. So stick with the water and milk for your child. And even the fruit juices, people say it's a fresh fruit juice. Unless you squeezed it yourself, there is either some preservative or something added sugar in those juices. And even if you squeeze it yourself, ideally eating the whole fruit is better, because it has the fiber and other nutrients in it, which if you squeeze the juice, all you're getting is the pure sugar coming out. Now, eating fruits on its own is much better, even though it has the sugar, because it has all the other things in it. So remember, if you want to make a lifestyle change and it's too overwhelming, start with this simple thing: 5-2-1-0. 5 fruits and vegetables, 2 hours or less of screen time, 1 hour of moderate or vigorous physical activity, and 0 sugar sweetened beverages. And if you had to pick one out of all, I would say cut the sugary beverages out. You're the one who's doing the groceries, so don't buy. Now that you have made changes in the lifestyle and in your diet, you're doing the portion control, you've bought all these different things are still not working. Your child is still struggling with the obesity or the overweight, obesity, and you're wondering what else is out there. So the AAPS also now approved the use of medications. I'm sure you have heard of some of these anti-obesity or weight loss medications in adults. So 2 of these medications are now approved for use in children older than age 12, and they are the GLP-1 receptor agonists, things like your semaglutide, which has been traditionally used in type 2 diabetes. So semaglutide and your Saxenda. So Wegovy and Saxenda are the 2 drugs that are approved for use in children older than age 12 who are struggling with lifelong obesity and overweight. So bariatric surgery is approved in children if their body mass index is more than 40. So morbidly obese in that category with a BMI greater than 40 is approved to get counseled for bariatric surgery if they are above the age of 15. So to summarize, obesity is a chronic pediatric disease. And just like these chronic other diseases, it is multifactorial in nature. There are many different things that goes into play. What is the parental weight, what is the eating behaviors of the parent, there is genetic, epigenetic factors, and then the largest role that plays is the lifestyle and the environmental. So you need to modify the one that you can control the most, which would be the lifestyle. So if you can control that, that would make a huge dent in this. Definitely you need to be in consultation, bring this up if you're worried about the weight of your child, and bring it up with your pediatrician to discuss in a non-judgmental, neutral way, because this is a health problem. This is not about, something that we worried about how we are looking. This is not about the appearance of the child. It is impacting the health of the child, not just now, but all studies show that childhood obesity has a huge impact on adult obesity. So most of these kids who are overweight or obese as children go on to develop adult obesity. So it is something, that needs to be discussed. And if the pediatrician brings it up, we need to make a plan as a family and see how we are going to help this child. So 5-2-1-0, try to incorporate these simple steps from the AAP to make some lifestyle changes, encourage the physical exercise, minimize the screen time, and at every meal, look at the plate. What is the child eating? Make sure we have fruits, vegetables, high fiber foods, and minimize the ultra processed food, because that's probably the biggest cause of obesity. So minimize the ultra processed food, minimize the junk food, and minimize the sugary beverages. You can make a difference. Just because you have a genetic predisposition doesn't mean you're doomed to your child is going to have obesity. Just because it's in the family and everybody is obese in the family, that your child also needs to be the same. You can make a difference. You can make a change. You can start today by incorporating some small changes. So I hope that helps. Please follow or please subscribe to my channel. I tend to post videos on different pediatric topics on a weekly basis. If you have any questions or comments, you can drop it in the comments and I will be happy to answer those questions. I hope this video helped clear up some confusion about pediatric obesity, and I hope to catch you in the next video. Thank you and have a good day. Bye.